Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, let's unpack this. Have you ever wondered if, that daily walk really cancels out the extra slice of cake?
Or maybe if hitting the gym hard means you don't have to worry so much about what you eat.
Exactly. It feels like this constant back and forth, doesn't it? Calories in, calories out. We hear so many conflicting things.
That's confusing.
So today, we're doing a deep dive into some fascinating new research. It's aiming to settle that big debate. Is obesity more about what we're eating or how much we're moving or not moving?
Yeah, and we've looked at a recent health news piece, but also, critically, the actual scientific paper behind it. It was published in the Proceedings of the National Academy of Sciences, a pretty major journal.
Right. So our mission here is to pull out the key stuff, give you the unvarnished facts as presented in the study, and really help understand what this might mean.
And it's a huge issue, right? Globally, especially in, industrialized countries. Obesity is a massive driver of disease, poor health. It's something we really need to understand.
Definitely. The core problem, that energy imbalance, too many calories coming in, not enough going out, that's been clear.
But the why behind that imbalance?
Yeah.
Is it mostly the too many calories part or the not enough energy out part? That's been the tricky question.
And that's precisely what this study, led by Amanda McGraski and her team, tried to get at. They wanted to clarify the relative weight, you could say, of higher calorie intake versus lower energy expenditure.
And they went about it in a really comprehensive way. They gathered data from over 4,200 adults ages 18 to 60.
Okay.
And this wasn't just one population. It spanned 34 different groups across 6 continents. You had hunter-gatherers, pastoralists, farmers, people in industrialized societies, really diverse lifestyles and diets.
Wow, that's incredibly broad. That kind of diversity is key if you want to draw conclusions that might apply more widely.
Absolutely. It gives you that range.
So with this massive, diverse group, what were they actually measuring? What were the key indicators?
They looked closely at energy expenditure. So total energy expenditure, that's all the energy your body uses in a day doing everything.
Right.
Then activity energy expenditure, which is just the energy burned through physical activity. And also basal energy expenditure, the energy needed just for your body's basic functions like breathing, digestion, that sort of thing.
Got it. Energy out, broken down.
What about the other side of the equation?
They measured 2 common markers for obesity: body fat percentage and the well-known body mass index.
Okay.
And importantly, they grouped these populations based on economic development using the UN's Human Development Index. That gives a sense of overall factors like wealth, health infrastructure, education.
So they could compare across different levels of development. Okay, they've got all this rich data. What did the first pass look like? What were the initial findings before they started adjusting things?
Oh, this is where it got really interesting. Initially, they found that total energy expenditure, activity energy expenditure, and basal energy expenditure were all actually higher in the more economically developed populations. Wait, higher. So people in developed countries were burning more energy overall.
According to the raw data, yes. But at the same time, measures of obesity, body mass index, body fat were also higher in those same developed countries.
Okay, hold on. That sounds completely contradictory. More obesity, but also burning more energy. How does that even work? What's going on there?
Exactly. It seems counterintuitive.
Oh.
And that tells you need to dig a bit deeper. The researchers knew that people in industrialized nations tend to be larger, overall taller, for instance.
Ah, okay. So body size itself could skew the energy numbers?
Precisely. So they adjusted the data. They accounted for differences in body size and also for age and sex, which naturally affect weight and energy use. This gives you a much fairer comparison across these very different groups.
Right, leveling the playing field, so to speak. And what happened after they made those critical adjustments? Did the picture change?
It did, significantly. After adjusting for age, sex, and body size, they found total energy expenditure and basal energy expenditure actually went down slightly by about 6 to 11% as economic development increased.
Okay, so a slight decrease in overall and baseline energy burn. But what about the activity part?
That's the crucial bit. Activity energy expenditure, the energy spent moving, was still higher overall in the more developed populations, even after all those adjustments.
Still higher, even after adjusting.
Yep. And that's fascinating because it really challenges that common idea, doesn't it? It suggests it's not likely a lack of exercise, a lower activity level, that's the main driver of higher body mass index or body fat in developed countries.
So the study is basically saying low exercise isn't the primary villain in the obesity epidemic.
That seems to be the implication. They found that total energy expenditure, overall energy burn, was only weakly linked to obesity rates. It accounted for maybe 10% of the increased obesity seen in more developed countries.
Only 10%. So if it's not mainly about how much people are moving, what did the study point to? What's the bigger culprit?
The researchers pointed pretty strongly towards diet, specifically a higher consumption of ultra-processed foods.
The UPFs.
Ah,
Things like, processed meats, ready meals, sugary snacks, those kinds of things.
exactly. The study explicitly stated that the percentage of ultra-processed foods in someone's diet was positively correlated with their body fat percentage. More UPFs, higher body fat.
Okay, that's a very direct link they're suggesting. But why? What is it about these ultra-processed foods that makes them potentially so problematic for weight?
Well, the authors suggest a few reasons. First, hyperpalatability. They're engineered to taste really good, often with combinations of fat, sugar, salt, and specific textures that make them hard to stop eating.
Dangerously delicious, basically.
You could say that. Second, they're very energy dense. You get a lot of calories packed into a relatively small amount of food.
Right. Easy to overconsume calories without feeling physically full.
Yes, and that ties into the third point. Their composition and even their appearance might mess with our body's satiety signals, the cues that tell us we're full. So you might keep eating even when you've had enough calories.
Okay, so taste, density, messing with fullness signals. Anything else?
There's also evidence suggesting that the way these foods are processed might actually increase the percentage of calories we absorb from them compared to less processed foods. So more of the calories you eat actually end up getting used or stored by your body.
Wow. So it's a multi-pronged effect. Taste, density, fullness signals, and absorption. That paints a pretty compelling picture of why they might be linked to weight gain.
It does. It suggests the quality and nature of the food is really critical, not just the raw calorie number in isolation.
Now, we always need to be careful, right? No single study tells the whole story. What about limitations here? What caveats should we keep in mind?
Absolutely. Critical perspective is key. This study used cross-sectional data. That means they looked at different groups at one single point in time.
Like taking a snapshot.
Exactly. And a snapshot can show correlations like the link between UPFs and body fat, but it can't definitively prove cause and effect. You can't say for sure because of development or because of diet. Body fat changed in a certain way over time based on this data alone.
Okay, so correlation, not necessarily causation proven here.
Right. And another limitation was that they didn't have super detailed dietary intake data for all the 34 populations. So while they could see the UPF link where data was available, they couldn't fully untangle every single environmental, social, or physiological factor that might be encouraging higher calorie intake or absorption across the board.
That makes sense. It's a complex picture. So let's circle back to exercise then. If this study suggests it's not the primary driver of the obesity epidemic, does that mean we can all just hang up our running shoes?
Definitely not. And the study authors are very clear about this. While their findings point more strongly to diet for explaining population-level obesity trends, they strongly encourage regular exercise.
Why? If it's not the main obesity driver, according to this.
Because exercise has so many other proven benefits, it's absolutely crucial for preventing a whole host of diseases, heart disease, diabetes, some cancers. It's vital for mental health. It reduces overall mortality risk, cardiovascular mortality. The list goes on.
Right. So its role in overall health is undisputed, even if this specific study questions its dominance in driving obesity rates compared to diet.
Precisely. Physical activity is fundamental to a healthy life. Full stop. This study is more about identifying the potentially bigger lever to pull when tackling the obesity epidemic, specifically at a population level.
That's a really important distinction. And speaking of the bigger picture, we shouldn't paint economic development or modern food systems as entirely negative either, should we?
No, not at all. There are significant upsides. Global food networks mean that, generally speaking, affordable food components are available almost everywhere, which is a huge human achievement.
True. And didn't the study mention something about growth?
Yes, interestingly, a lot of the extra energy available in modern food systems seems to go towards healthy growth. People in industrialized populations are, on average, taller and have greater fat-free mass, muscle, bone, organs.
So not all the weight gain is fat.
Exactly. In fact, the study found that a large part of the increase in body mass index seen with economic development was actually due to this increase in fat-free mass.
It's fascinating. It suggests maybe body mass index alone isn't the perfect measure for tracking obesity trends if it doesn't distinguish between fat mass and muscle mass.
That's a point the authors raise. Using measures that specifically look at body fat percentage might give a clearer picture for tracking and preventing obesity rather than relying solely on body mass index.
So let's try to boil this down. What are the big takeaways for someone listening?
Well, I think this deep dive really shifts the spotlight, doesn't it? When we're talking about the global obesity crisis, this research suggests we should be looking very closely at what we're eating, especially the rise of these ultra-processed foods. It seems to be a much bigger factor than changes in physical activity levels.
Even though activity levels might actually be higher in developed places, which is kind of mind-bending.
Right. But the unique characteristics of ultra-processed foods, that hyperpalatability, energy density, impact on fullness cues, maybe even absorption, seem to really encourage overconsumption in a powerful way.
It definitely highlights a huge challenge then. If diet, especially these UPFs, is the main driver, how do we manage our food environments better?
That's the million-dollar question, isn't it? How do we keep the benefits of having plentiful food available, but steer away from diets that are nutrient-poor and obesogenic, likely to cause obesity?
It points towards needing bigger public health strategies focused on food quality and the food environment, maybe more so than just telling individuals to move more.
Potentially, yes, or at least a significant rebalancing of the focus.
So what does this all mean for you listening? It's really about being informed, understanding these nuances, recognizing that the answers aren't simple equations like calories in equals calories out. Complex systems are at play.
Yeah, it encourages you to think critically about the food you eat, where it comes from, how processed it is.
Definitely.
Yeah.
Keep considering how your food choices impact your body, beyond just the calorie count. And, keep an eye on this research. Science is always evolving, and understanding these drivers of health is just so important.
Thanks for tuning in to the Health Headliner podcast by Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.